Very good morning and welcome to Apollo 24/7's Health Hour. Health Hour is a show where we bring an Apollo's expert every Sunday to this live show and where you can ask your questions and we shall be bringing answers for you. Today's expert is Dr. Saptarshi Bhattacharya and we are talking about a very interesting topic. Is diabetes reversible? आपके जितने भी questions है तैयार हो जाइए. हम डॉक्टर साहब के साथ आपके questions पूछेंगे and we'll get answers. While he's going to join us in a very short while, let me tell you that this show also is going to have a health quiz where you can participate and win prizes from Apollo 24/7 app. And also we're going to give away discount vouchers and coupons towards the end of the show. चलिए आज के टॉपिक के बारे में बात करते हैं. अपने आज के एक्सपर्ट को इनवाइट कर लेते हैं. So let's meet Dr. Saptarshi Bhattacharya, who is a senior consultant endocrinology from Indraprastha Apollo Hospitals, New Delhi, and a very eminent doctor who has been in the field since last 15 years, and he's the director e-health diabetes and endocrinology center Noida, executive committee member of Endocrine Society of India 21 से 2024 तक वो रहने वाले हैं executive committee member की तरह. Then founder secretary of Endocrine Society of Delhi, ex-president of Society for Promotion of Education in Endocrinology and Diabetes, that is SPEED, and his achievements and awards, President's Awards for Appreciation in 2021 Endocrine Society of India say, and scientific secretary Endocrine Week in 2020, which was organized by the ESI, and he has published more than 60 publications in national and international journals. He specializes in endocrinology, diabetes, thyroid problems, PCOS, obesity, and erectile dysfunction as well. There, doctors joined us. Good morning, Dr. Saptarshi Bhattacharya. Welcome to the show once again.
Good morning. Thank you for inviting me.
Yes, doctors, it's so good to see you. I know it's a Sunday morning, and we understand that one Sunday doctors are never on leave. So it's so good to have you here.
Thank you.
जी. So आज तो मैं एक बहुत ही कंट्रोवर्शियल, सेंसेशनल, सनसनाहट वाले टॉपिक के साथ आई हूँ आपके सामने. जनरली whenever we talk about diabetes, we talk about management. बट आजकल इंटरनेट अगर मैं ओपन करती हूँ, एवरीवेयर एवरीबडी इज टॉकिंग अबाउट हम डायबिटीज को रिवर्स करेंगे. सो आई वांटेड टू आस्क यू, इज डायबिटीज रिवर्सिबल? फर्स्ट एंड फॉरमोस्ट क्वेश्चन, बैंग ऑन, लेट मी आस्क यू, इज डायबिटीज रिवर्सिबल?
Yes, but there are preconditions. It's simple answer. It is reversible, but there are preconditions.
ठीक है, but then I also understand that people who claim that diabetes can be reversed are giving a kind of hope, and which might be a false hope. What is the actual hope that we can give? Reversible का शब्द होता है अगर हमें कुछ हुआ है, for example, if I am not well today and tomorrow I am out of it, वो reverse करना होता है. Is diabetes one of those?
See, before we go into this discussion, it's important to understand there are three different terms which are often used related to this. One is reversal, one is cure, and the other is remission. So reversal or cure are almost similar words, and that means you have any condition and you are totally out of it, so you don't require any monitoring, you are not in any danger, there is no risk of recurrence. Say somebody had malaria and that person got the right treatment and that is a cure, so that condition is not going to cause any problem in future. So for diabetes, if we understand the pathophysiology of diabetes, it has a long pre-diabetes stage, and there are other metabolic factors, genetic factors, which are always working and creating the tendency for elevating blood glucose. So it's not just a blood glucose value. So there are other factors like our cardiac health, our blood pressure, our lipids, our overall physiology is affected in diabetes. So if we are talking about diabetes, it's a chronic condition, and if you ask me, अच्छा diabetes पूरा ठीक हो जाएगा, मैं कल मीठा खाना शुरू कर दूंगा, वो नहीं होगा. So it can go into a stage where the medication requirement can go down, provided you satisfy those preconditions where you are at a higher risk of being higher possibility chance of having going into remission. So the better term for diabetes will be remission rather than reversal or cure, where you have controlled your blood glucose values, but you still need some amount of monitoring. So it has not been entirely cured. So sometimes we have two
Great.
different terms being used called physiological versus biochemical remission. I will come into that later.
Great. So, Dr. Saptarshi, it was a very, very valuable statement that you made. Reversible and cure are not the terms that we use in diabetes, but we can use the term which is called remission. So, this is where we will turn all the discussion, divert all the
Right.
discussion today. So, to all the viewers who are joining us, a very welcome, a warm welcome on this Sunday morning once again, because I see suddenly that a lot of people who have joined and saying good morning to you, doctor. And when
Thank
they're
you. Good
asking
morning.
कि
Good morning.
thanking Hindi में बोलिए and English में बोलिए and Telugu में बोलिए, a lot of people, yes, multiple languages, people are watching this all around India. And Dr.
Thank
Saptarshi,
you.
which languages do you speak?
I can speak in English, I can speak in Hindi, I can speak in Bengali. I can't speak in
All right.
Telugu.
So
I need to learn
आपके
Telugu.
बंगाली व्यूअर्स के लिए भी हम कभी कभी बंगाली यूज करेंगे. मेरे तेलुगु व्यूअर्स, आई कम फ्रॉम हैदराबाद, సో हम తెలుగు అగర్ ఐ సమ్ అప్ ఎక్కడెక్కడైతే డాక్టర్ గారు ఇంపార్టెంట్ పాయింట్స్ చెప్పారో మై డియర్ వ్యూవర్స్, నేను తెలుగులో మీకోసం అక్కడక్కడ చెప్తాను. ఇప్పుడు చెప్పింది ఏంటంటే డయాబెటీస్ రివర్స్ చేయడం అనే టర్మ్ ని, పూర్తిగా నయం చేయడం అనే టర్మ్ ని మనం ఇక్కడ వాడకూడదు. డయాబెటీస్ కొన్ని సందర్భాల్లో మందు తగ్గించుకునే వీలుగా అది తగ్గుముఖం పడుతూ ఉంటుంది, దాన్ని రెమిషన్ అంటాము. అది అలా ఎంతసేపు మనం ఉంచగలమో దాన్ని, అది ఆ మేనేజ్మెంట్ గురించి ఈరోజు మనం మాట్లాడుతున్నాం. సో దాట్ ఈస్ इट डॉक्टर सप्तर्षि. आपने जो भी अभी रेमिशन के बारे में बोला है, आई हैव इंट्रोड्यूस दैट टॉपिक टू माय तेलुगु ऑडियंस. तो लेट्स कंटिन्यू दिस रेमिशन. ये टर्म बहुत ही इंटरेस्टिंग है. सो आई कैन नॉट कॉल दैट आई एम क्योर्ड फ्रॉम डायबिटीज, right? I cannot
It's
claim
not possible.
this.
No, 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 no. So it's
So
so cure
कौन
means it's totally gone. So it's always a risk, always remains with diabetes. So maybe somebody is off medicine, but that does not mean the lifestyle change which has led to that state, that somebody was diagnosed with a high blood sugar and he did all the right things. He's off medicine right now after 5 months or 6 months of following all the right things. So if he starts doing something wrong, starts to the previous lifestyle of eating junks, not exercising, eating sweets, so it's going to come back in 6 months, 1 year, or 2 years, if or even earlier. So it cannot be cured, it cannot be reversed, it can go into remission. So that we need to understand right at the beginning.
वाओ. सो दैट वाज अ वेरी पावरफुल स्टेटमेंट यू मेड. तो ये स्टेटमेंट के साथ मैं यहाँ पर मैं देख रही थी मिस्टर नरेंद्र कुमार शर्मा जी ने मैसेज किया है, सर आई रिवर्स माय डायबिटीज, आई एम ईटिंग अनलिमिटेड स्वीट्स, नो शुगर इश्यूज, इट इज अंडर 100. तो ये जो हम बात कर रहे हैं ये हनीमून फेज है. तो इन्होंने जो रिवर्स किया है, समझ रहे हैं, हाउ लॉन्ग डू यू थिंक दैट ही इज गोइंग टू कंटिन्यू विद हिज रेमिशन स्टेटस अगर ये स्वीट खा रहा है एंड अदर लाइफस्टाइल चॉइसेस नहीं मेंटेन कर रहे हैं?
Again, so I think if you want to draw a comparison, so I briefly mentioned the term biochemical remission versus physiological remission. Biochemical remission means you are looking only at the glucose value. अच्छा, मेरा
जी
शुगर पहले 300 था, अभी 100 है, तो मेरा डायबिटीज क्योर हो गया या रिवर्स हो गया. So that is not how you look at it. So you need to look
जी
into physiological remission. So diabetes is a disease which is a multi-system disorder. So we glucose value is one aspect of it. साथ में किसी को कार्डियक डायबिटीज के साथ ब्लड प्रेशर होने का भी टेंडेंसी होता है, कोलेस्ट्रॉल प्रॉब्लम्स होने का भी टेंडेंसी होता है. सबसे ज्यादा खतरा रहता है हार्ट रिलेटेड प्रॉब्लम्स होने का, कार्डियक डिजीज होने का प्रॉब्लम्स. देयर इज अ मेजर रिस्क इवन इन द प्री डायबिटीज स्टेज ऑल्सो. जिनका शुगर बॉर्डर लाइन चल रहा है उनको भी कार्डियक प्रॉब्लम्स होने का चांसेस ज्यादा रहता है. तो वी नीड टू बी like looking at not the glucose value only. So maybe the glucose value is well controlled, but still in an unhealthy lifestyle there will be two negatives. One, that remission is not going to last very long. ठीक है, 1 साल हो जाएगा, 2 साल हो जाएगा, maybe if you are very lucky 4 5 years भी हो जाए, लेकिन usually that is going to come back unless it was because of some other reason. Somebody took a short course of steroid, कोविड हुआ था उस टाइम में डॉक्टर ने स्टेरॉइड दिया, कोविड ठीक हो गया, स्टेरॉइड बंद हो गया और शुगर जो बढ़ गया
जी,
था वो ठीक हो गया. So that is a different issue.
we've seen
Then
these
that is not
cases.
diabetes. Yeah, so that
Yeah,
is,
we've
but
seen
that
a
is
lot
not
of these.
diabetes.
Right,
But
right. It's not
that
diabetes.
is like a steroid induced hyperglycemia. So we are not labeling that as diabetes. डायबिटीज मतलब जब हम देख रहे हैं कि शुगर्स भी बढ़ रहा है, साथ में HbA1c जो 3 मंथ्स का एवरेज ब्लड शुगर का आइडिया देता है हमें, वो भी बढ़ा हुआ है. बाकी ये सारे पैरामीटर्स दोनों जब सेटिस्फाई करता है तो उसमें देन विल लेवल का अच्छा डायबिटीज है. कि किसी जस्ट शुगर स्टेरॉइड से बढ़ गया, दैट इज नॉट डायबिटीज, सो दैट इज अ डिफरेंट एंटिटी. सो वी कांट टेल कि अच्छा डायबिटीज उस टाइम का डायबिटीज ठीक हो गया मतलब डायबिटीज क्योर हो गया. किसी का डायबिटीज है, अच्छा शुगर पता चला, धीरे धीरे कंट्रोल हुआ, मेडिसिन बंद हुआ, लाइफस्टाइल कंटिन्यू हुआ, डाइट डाइट एंड एक्सरसाइज द पर्सन इज कंटिन्यूइंग, तो मे
मैनेज
बी
करते हैं.
कैन मेंटेन without medicines for a long time. But again, so every the risk of recurrence remains.
जी, जी. अ, प्रवीण भाई पोपतानी जी, आपने किसी और लैंग्वेज में टाइप किया है, मैं वो आपके लैंग्वेज रीड नहीं कर पाती हूँ. अगर आप इंग्लिश या हिंदी में टाइप करेंगे तो मैं सर के सामने आपका क्वेश्चन लगाऊंगी प्लीज. एंड आई अंडरस्टैंड इंग्लिश, हिंदी, तेलुगु, बट आई कैन नॉट रीड अदर स्क्रिप्ट्स. सो in case you're typing it in other fonts and scripts, please make sure that you're typing it in English. That will be easy for me to read it out. So, Doctor, while I'm looking at all the people who are commenting and asking their queries, there is a lot of question and confusion about type 1 and type 2. While we're talking about remission, is this remission, are we talking only about type 2 diabetes, or is it only for one, or is it applicable for type 1 diabetes as well?
So, Jhansi ji, before I answer that question, I need to explain to our audiences what is the difference between type 1 and type 2 diabetes. So, type 1
Fantastic, Doctor.
diabetes is a
Vasanti,
is a
your question is being answered here. Vasanti Maknawa has just, Makwana has just answered what is the difference between type 1 and type 2 diabetes? It is very confusing. So please go on, doctor.
So type 1 diabetes is a condition which usually occurs in children or younger adults, and it's a autoimmune disease. So there is a damage to the uh, pancreas and the insulin secretory mechanism of the body, where the insulin secretion from the pancreas becomes almost zero. So there is an absolute insulin deficiency in type 1 diabetes. The cause behind that is an autoimmune damage. Autoimmunity का मतलब ये होता है कि आपके बॉडी का जो इम्यून सेल्स है, तो वो अपने आप का आपका ग्लैंड या आपका कोई बॉडी के इंटरनल ऑर्गन को ही that immune system perceives as a foreign body and is damaging that system. So that is why the insulin secretory mechanism of pancreas becomes dysfunctional. So no insulin is secreted. As of now, in today's medical science, we only have one solution for that. That is to give insulin from outside. Unless we are giving insulin, there are chances of very severe complications like diabetic ketoacidosis, and the person can land up in the hospital with severe complications. So,
Okay.
type 1 diabetes, it's a totally different disease, very, very different from type 2 diabetes. So, you need to be the person who has type 1 diabetes needs to take insulin for rest of his life unless we have some medical breakthrough in between and we have an alternate solution. So there are research is going on related to stem cell therapy and all those things, but again those are in experimental stage. We do not have stem cell therapy as a standard treatment for type 1 diabetes right now, so that is no, we cannot offer somebody as a part of treatment for type 1 diabetes. There are some claims that type 1 diabetes is being reversed. Here I would like to mention there is a transient phase in the early part of type 1 diabetes. Type 1 diabetes diagnosed हुआ, शुरू में शुगर 400 500 600 है, कुछ दिन इंसुलिन चला, देखा गया कि इंसुलिन का रिक्वायरमेंट कम हो रहा है, और उस ट्रांजिएंट कभी कभी 3 से 6 महीने से 8 9 महीने तक भी कभी कभी इट कैन लास्ट. So that phase is called honeymoon phase, that is used specifically for type 1 diabetes, not for type 2 diabetes. And that
Okay.
phase or honeymoon phase, like honeymoon does not last forever, so that phase also doesn't last forever.
True,
So
true,
there
true,
is a
true.
it's usually it will come back, so it's very very unlikely it will not come back. So maybe 3 महीने 6 महीने किसी किसी को इंसुलिन का रिक्वायरमेंट नहीं होता है, but that should not be considered. We do not use the term reversal or remission or cure for that particular phase. So we know that we also, when we deal with such children or adults, we tell them this is a short term period, you need to keep on monitoring your sugars, it might come back anytime. Type 2 diabetes is totally different. It's a slow metabolic derangement that occurs over years. जब डायबिटीज पता चल रहा है टाइप 2 डायबिटीज, ऑलरेडी बॉडी का जो इंसुलिन मैकेनिज्म है तो उसका 70-80% ऑलरेडी इंसुलिन बनाना बंद कर चुका है. So, and there are other factors like insulin resistance also. So if somebody is overweight or obese, the insulin which is being secreted, that is also not able to act properly. So that's a more complex mechanism. It is multifactorial. So there are physical there are factors related to environment, diet, physical activity, mental stress. All this combined together produce type 2 diabetes. So type 2 diabetes is different. Usually it's controlled with oral tablets, but sometimes if it's long standing, the tablets stop working and we even have to give insulin in those cases. But giving insulin in type 2 diabetes does not make it a type 1 diabetes. So the person still requires type 2 diabetes and will require insulin because maybe the person has a complication or there is the medicines are not working. So these are two totally different situations.
G. So while you have established what type 1 diabetes is and what type 2 diabetes is, तो आज का हम फिर से क्वेश्चन वही लेके आते हैं कि रेमिशन टाइप 1 डायबिटीज में हो सकता है तो वो शॉर्टर फेज में होता है एंड टाइप
We
2
don't even
डायबिटीज का
use the term type 1 diabetes. May it's too risky to use the term remission. It will give a false, even we don't, we, it will give a false sense of
remission.
complacence. So I want to,
So
type 1 diabetes is a disease which requires insulin. It occurs in younger children, even small children also. So as of now, we do not have anything anywhere in the world, best of centers, only insulin. There are different ways of giving insulin. It can be given through injection, it can be given through pen, it can be given through pumps, but
G.
insulin is the only standard treatment. So, and type
और
1 diabetes cannot be reversed, so it's a very short lasting phase. Type 2 diabetes is the one that can be reversed if you satisfy some conditions. We'll go into that later, and also if you
yes.
are doing everything in the correct way.
Great. So, Robin, I think your question is answered. Now, I would want to take Avinash's question. Avinash's daughter is 8-year-old, type 1 diabetes, and good diagnosed hua hai. Okay, I have a power cut, but I can continue here. So, Avinash Reddy's daughter is 8-year-old, type 1 diabetes hai. He wants to know if this can be reversed.
So again, as of now, Avinash, we do not have a reversal treatment for type 1 diabetes. So you must have consulted your doctor, a pediatrician or endocrinologist or physician. So he or she must have advised insulin to your daughter, and we need to keep on monitoring. In early part of what I told, there can be a transient short lasting phase of where the insulin requirement goes down, but insulin is the standard therapy for diabetes, type 1 diabetes, and it should be continued with medical supervision. Type 1 diabetes cannot be reversed. Very very strong treatment. Don't try anything else for type 1 diabetes. There is no confusion on that. Type 1 diabetes, insulin should be given. So, and that is the standard treatment world over. So nothing
Great.
works for type 1 diabetes. Very strong. So, there is no confusion regarding that.
Great. Thank you so much for stressing on this. We'll come back, Raja Ramji. I'll come back to your question. Metformin and type 1, not insulin. We'll come back to that type 1, sir. But even before that, there are a lot of people who are asking about HbA1c levels and, pre-diabetic, Rajesh ji पूछते हैं. Then also, yeah, here's Dipanshu's question. Mother's HbA1c levels are 6.3. Can she be called diabetic? What do you recommend? Her age is 63. तो ये क्या है HbA1c एंड कौन सा नंबर डिसाइड करता है कि हम डायबिटिक हैं या प्री डायबिटिक है?
So again, so there are two things. So simple definition of diabetes जो world over followed होता है. So it can be done either through glucose or through HbA1c. HbA1c gives us an extrapolation of last 3 months average blood glucose. So
ओके,
if we are going by HbA1c, the normal value, absolutely perfect value is less than 5.7. 5.7 to 6.4, we label it as pre-diabetes. More 6.5 and above, we label it as diabetes. So if somebody's HbA1c is 6.3, so that means the person at present is having pre-diabetes. But again, having said that, don't it's if somebody had a HbA1c of 10.1 4 months earlier, and diets and exercises and takes medicines properly, and HbA1c comes down to 6.3, so that does not mean that person has come back to pre-diabetes. These terms are only used for the initial diagnosis. If somebody has been diagnosed with diabetes, so if your HbA1c comes down to the normal range or in the pre-diabetic range or around 6.7 or 6.5 or 6.2, we'll only label that person as having diabetes, but whose diabetes is well controlled. That person does
ओके,
not become pre-diabetic right now.
ओके। सो एक बार लाइन क्रॉस कर लेते हैं तो वापस आते हैं, दैट डजंट मीन दैट यू आर फ्री फ्रॉम डायबिटीज। वंस डायबिटिक यू आर नोन टू बी डायबिटिक, राइट? दैट्स व्हाट आई अंडरस्टूड।
Almost,
तो अभी
almost.
दीपांशु's mother, yeah, so दीपांशु's mother 6.2 है and then 6.3 है and 6.2 and 63 year old है, so ये प्री डायबिटिक में ही है अभी?
If she's not on any medicine, it's if it's then she is pre-diabetic. She is having
Okay.
pre-diabetes. If she is already on medicine and HbA1c is 6.3, then she is diabetes who is well controlled. So I need to
Oh,
see,
okay.
the report does not tell you everything. So the report is just a value. So again, we need to see it in the clinical context. It's very, very important. If no medicines, no past history of elevated HbA1c, no past history of high sugar, then we call her as pre-diabetes. Any past history, and if she had been on medicines, then it is diabetes which is well controlled.
Wow. So if people can claim that I have reverse diabetes, then I need to take it with a lot of other information, and I cannot isolate
Right, right.
information. और जो ग्लूकोमीटर पे आज का रीडिंग है, we cannot read that and say that I'm free from diabetes. Wow, so
No,
much.
absolutely not.
Well, here's another question. Ajit Nair ji है, HbA1c 6.2, fasting 97 है. Is this reversible? I think understanding that Ajit Nair is only pre-diabetic and was never diabetic. What
See
in case
again.
if I could do this, because I at a point of time had touched 6.1 on my HbA1c, and I was really very cautious. I went into one panic mode and started with all my diet, regime, exercise, lifestyle, and I went back. I controlled it. So understanding that Mr. Ajit Nair is in one of those brackets, what would you want to tell people like us?
So I think so. First of all, what we started with is diabetes is a progressive disease. So
Correct.
these are just numbers. So overall, the idea for medical for getting for yourself or getting any treatment or getting any investigation is to stay healthy on the long term. So 6.2 or 97 as of now, it's in the by HbA1c, he's in the pre-diabetes range, and pre-diabetes is very much reversible. So if somebody is following the, like you did all the right changes, started dieting in the proper way, have some regular physical exercise, stop eating junks, maybe to start doing some meditation or some de-stressing in whatever way you are comfortable, so all this will definitely help in improving your overall metabolic health. Don't go by numbers. Numbers are only one indicator. There are so many other things which you need to look into.
Gee,
But this is
wonderful. Thank you so much.
pre-diabetes. To answer his question, pre-diabetes is reversible. So it's obviously it's a much earlier stage of diabetes. So it can be reversed.
Super. तो अभी हम लोग एक कंट्रोवर्शियल टॉपिक में आएंगे. सोमनाथ is asking this question कि one of their relatives have attended 1 week of an Ayurvedic session. So they are saying that the sugar level is normal without medicine and they have cured diabetes completely. तो ये claims तो काफी सारे alternate medicine या मैं बोलूँगी कि other streams of treatment options में ये claims काफी सारे सुनाई देते हैं. What would you want to address this as?
I thank you for asking that question. So this is something many of my patients do ask in my clinic, that some we went there, we took this treatment. So again, so my first response to that will be, so anything which is giving you good health, giving you the right targets in your blood sugar values as well as other values, you can try that treatment. But the important thing is that I since my background is from allopathic medicine, so I if I am prescribing a medicine, I know, okay, this is the salt which is there, these are the advantages, these are the side effects, this is what all you need to do when you're taking this particular medicine. For Ayurvedic, I am not qualified to answer in that way, so that is the first thing. So I put my hands up and I tell I am not the best person to answer it. But if a particular form of therapy is giving you results, if you are feeling good, if your sugars are going down, obviously you can go ahead with, you can try it out. But it is important to keep on monitoring it. So 7 days, you had led a very healthy lifestyle. Your sugars came down, your insulin was stopped, your medicines came down. But once you stop going out of the, you stop attending that place, you come back to your regular routine, you start eating your normal foods, and then start
जी.
going to office, have additional stress, stop exercising. After 1 month, after 2 months, after 3 months, are you able to maintain an HbA1c? So if something for, if you do for 7 days and after 6 months or 1 year, your HbA1c is controlled, your sugars are controlled, perfect. You please, I'll ask everybody to go there. then, but but sadly, most of the time, in my practice, as we do keep on getting all type of patients, but the sustainability it's not that well sustained. So you can try it out, but I am not discouraging you for anything. It's you can take a call on all sorts of medicine. I do have respect for all sorts of medicine, even though I am not qualified to comment on other types. But it's very important, whatever you are doing, you keep on monitoring. If it's not giving you the right result means H1C should be 6.5 or less than 7 at least. Your BP parameters, your cholesterol, everything should be right. Keep on monitoring regularly. If those parameters are, if they are in the target range, go ahead with it as long as it's normal.
Great. Thank you so much for that confidence, because it is important to monitor. That's a statement that you made. And what are these parameters to watch out while monitoring? What are the tests that you would recommend that a diabetes person with diabetes should continue? Because I had one bua who thought कि जो prescription 3-4 साल पहले का है, she continued her medication in the same way and it was quite complicated towards her end. So what are the tests and parameters that one should continue?
So, okay, again, this is very important. So, you need to have your fasting blood glucose in the range of, say, 90 to 100 or 110 or 120, depending on your age. So, with higher age, we go for slightly lesser tight. We do not go for that tight a control. With younger age, somebody has a long span of life, had more chance of complication coming up in the next 2-3 decades. They have to be really very well controlled. So their fasting target should be like 100 or plus minus 10. HbA1c should be less than 6.5. For with age, at least it should be less than 7. For elderly with multiple problems who are at risk of hypoglycemia, it sometimes can go up to 7.5 or 8. So these are the two prime targets for controlling blood glucose. Also, the post meal should be less than between 130 to 180. That is the standard target, which is usually mentioned. And also you need to have lipids in the normal range. Don't go by the range in the labs, because people with diabetes, they have a different lipid target, so you need to discuss with your doctor whether, in spite of an apparently, so many of my patients ask me, lipids to normal, why are you giving me a statin? So that is a very, very important cardioprotective medicine which is recommended for many of the patients with diabetes. So that is something which we need to look into. BP is very, very important, and also you need to
Right.
monitor for all the complications of diabetes. So these are all the things. So there are annual screening for retina, for kidney, for liver. So all these aspects, for there are some periodic checkups for heart. So all these tests need to be done, whatever form of treatment you are in. So if your targets are in the right range, if you are screened for complications, if you are free from them, then whatever is providing the right result, you can do.
Okay, great. So all these tests can be found in Apollo 24/7 app as well. Download the app and make sure that you are having the power of being able to monitor your diabetes while you're managing it. Thank you, Dr. Saptarshi. There, one important question about medication and lowering the medication over a period of time. When you call diabetes into a remission stage, definitely your medication levels are coming down. Here's people who have taken quite a lot of medication earlier and then इनका कम किया गया है dosage. How long will I be in this stage of this remission is the question, doctor. So let's talk about this phase of remission before I actually put the question to you. So कौन remission में जा सकता है, ये आपने establish किया है. तो ये remission phase, how long will this last?
So again, I would like to mention that the type 2 diabetes who have a recent onset, एक दो तीन चार साल के अंदर है, type 1 diabetes cannot go into remission. Where type 2 diabetes are recent onset, ready to exercise, ready to make lifestyle changes, motivated, and ready to keep on doing it. So they are the ones who actually have a higher chance of going into remission. So if somebody is having a diabetes for say 10, 15, 20 years, already having complications on multiple medications, the chance for remission for them, it's very, very, very less, practically nil. So first of all, you need to understand who all can go into remission. Now the important problem is how you go into remission. So first of all, if somebody is having a HbA1c persistently in the range of less than 6.5 without any medicine, so that is when we call remission. So it's a simple definition. So if you are not on any medicine, not even metformin, or which is the usually considered as the basic medicine for diabetes. So what is remission? Remission, HbA1c less than 6.5 without any medicine, but obviously you need to continue with lifestyle changes and diet changes and physical activity, and some de-stressing, which is physical stress is also mental stress is also very important. So these are the ways you achieve remission. So you can achieve remission by restricting calories, you can achieve remission on top of that by physical exercise. There are you can take some medicine, go for very aggressive diabetes control. Once the sugars come down, sometimes we do see patients do not require medication for 1 2 years. That also happens, so you can get it with drugs also. If somebody is overweight or obese, so the most common way to achieve remission, which is by weight loss. So if in early part of diabetes, if you lose 10% of your body weight, so if somebody is weighing 80 kg and the person comes down to loses 10% and comes down to 72, there is a distinctly higher chance of remission. So if you early part of diabetes, 10% body weight loss, chance of remission goes up. And sometimes we do see that there is a surgical procedure which is getting quite common nowadays, that is bariatric surgery, or sometimes we now even call it metabolic surgery. So some people who are usually obese or overweight and undergo this surgery, there are one aspect of surgery is the food intake gets restricted, but it's not calorie restriction which is the only thing that causes the
Correct.
diabetes remission to go down, or the medical in requirement for medicines or insulin to go down. There are other hormonal changes also which takes place after the surgery that induces uh, remission. So some people who undergo metabolic surgery or bariatric surgery, they also do go into remission. But again, there are, if somebody is having very long standing diabetes 15 20 years, so the chance of remission even after bariatric surgery is going to be less. So remission, diet, lifestyle changes, physical activity, some medicines, in extreme cases, bariatric surgery if somebody wants to opt for it. And so these are the ways to go for remission. And even after going for remission, the glycemic monitoring should continue. HbA1c has to be monitored periodically along with screening for other complications of diabetes.
Great, great. So thank you so much for that information because it is a very, very important session. People, I would advise you to note the timing here and go back to this video to re-watch the entire session. Whatever those last 2 minutes that you spoke, Dr. Saptarshi, I think is one of the essential, if I can say, that's the crux of today's show. Wonderful. So here, this is Zarana who's saying that with diet and lifestyle modifications, she's achieved remission. How can I make this remission last longer? That is Zarana's question.
So the simple answer, whatever has led to remission, that has to be continued. So, so if you are again, we have situations like somebody gets diagnosed with diabetes, goes some for from extreme form of dieting, so carbohydrates become zero in the diet, the blood glucose go down, the medicines go off. But that person needs to ask himself or herself that whatever he has been doing, is he going to sustain it for rest of his life? So is
Correct.
that sustainable? So if you
मैं
are
ये
doing something,
मैं ये question I would want to take the name because I've been avoiding the name the ketogenic diet, but इतने
yes.
सारे लोग मुझे advise किए, they've been asking me to do and get onto the keto bandwagon. I said no because that is not sustainable with me for a long time. Even though you're going to do my pre-diabetes reversal with that, I don't want to get onto it. Was my answer. So ये जो हम लोग fat diets के बारे में बात करते हैं, what is your opinion on it?
So again, keto. There are two fat diets which are becoming extremely popular. One is ketogenic diet. So it was very popular maybe another 3 4 years back. So it has the
Yes, yes.
popularity has gone down slightly. So now I think
Slightly.
intermittent fasting is more popular. So that is being
Yes.
discussed more often. So everything is okay. So again, has to be done scientifically. Ketogenic diet is a complex diet. If you are having, so your carbohydrate content in the diet becomes 5%. So for a standard Indian diet, the carbohydrate content is like 65 to 70%. So यहाँ पे वहाँ पे आपके वहाँ पे चावल नहीं खाएंगे तो राइस नहीं होगा तो they will feel
होगा तो
incomplete. In
correct.
Delhi or
Not if they
Punjab or Haryana, if they don't have paratha or
गेहूं नहीं होता है. हाँ.
roti, they will feel incomplete. So bulk of our diet is carbohydrate. So if you stop carbohydrate totally and go, it has to be less than 5 or 10% in ketogenic diet. If that, so that type of diet where bulk of the calories coming from fat, if you are able to sustain it, then it's fine. If you feel no, this is not sustainable, so you might go into a temporary remission with this, but whenever you come back to your normal dietary pattern, there is a very high chance that whatever remission you had achieved, you might lose it. It might get sustained for some time, but usually there will always be a tendency that whatever benefits you had initially, you might lose all that. So still, it can be tried, but it's difficult to sustain at least some form of dietary restriction. A standard balanced dietary restriction has to continue. That might sometime work, might not work. But another thing which we are discussing was intermittent fasting, where somebody is not taking any calories for almost 16 hours. So that is the
Correct.
minimum for intermittent fasting. So you can't have intermittent fasting for 10 hours or 12 hours. Anyway, you're overnight, we are not eating anything for 10 12 hours. That does not
तो
qualify
12 घंटे तो आराम से हो जाता है. हाँ.
in any way. So 16 hours is the minimum duration. So there are, it's not about calorie restriction only. So there are other mechanisms which come into play with these diets. So all of them have been extensively studied with not very promising results. Had it been so promising, everybody would have been doing it. And the main problem is whether you will be able to sustain it for 1 year, 2 years, 3 years, 5 years. So, and whenever you are not able to sustain it, the chances are majority of the benefits which you had gained, you are going to lose majority of that.
राइट. सो जराना जी जो भी आप कर रहे थे अगर वो सस्टेनेबल और आप मेंटेन कर सकते हैं तो प्लीज कंटिन्यू एंड एंजॉय योर रेमिशन फेज. भानु प्रकाश जी का नेक्स्ट क्वेश्चन है, डॉक्टर I'm on diabetes reversal through systemic diets and my A1C reduced to 5.8 from 6.6. I've stopped all the diabetic GP tablets. My question is, shall I maintain the diets without tablets? And the age is 49-year-old male.
So obviously, dietary restriction and physical activity should continue. So if this is just see this, we are looking at a physiology. We are not looking at numbers. So if you had diabetes at some particular point of time, your body is still predisposed to some sort of complication. So even we know that pre-diabetes, people with pre-diabetes have a tendency towards complication. If you go into diabetes, the complication rates go up even further. So even if you have past history of diabetes, it's very good that you have been able to bring it down to less than 5 point, so near around 5.8 or 5.6 without any medicines. That is commendable. But again, most of the things you have done till now to do it, to achieve that target, you need to continue that. So whenever you become relaxed, start eating sweets and stop your exercise and start eating extra fats and junks, so the chances of going back to diabetes is very very high.
Right. So to all the viewers, quickly मैं तेलुगु में एक बार बता लेती हूँ, with your permission, doctor. సార్,
Sure, sure, sure.
ఇప్పటి వరకు జరిగినటువంటి డిస్కషన్లో డాక్టర్ గారు ఏం చెప్పారంటే, డయాబెటీస్ రెమిషన్లోకి రావాలి అంటే మీరు మందులు అవసరం లేకుండా ఆ నంబర్లను మీరు కంట్రోల్ చేసుకోవాలి అంటే ఫస్ట్ అండ్ ఫార్మోస్ట్ లైఫ్ స్టైల్ చేంజెస్ తీసుకురండి, ఆహారంలో మార్పులు తీసుకురండి. ఒకవేళ మీరు కనుక రెమిషన్ ఫేజ్లోకి వచ్చినట్టయితే దాన్ని ఎక్కువ రోజులు మెయింటైన్ చేయడానికి మీరు ఆ పద్ధతిని కంటిన్యూస్గా ఫాలో అవ్వగలరా లేదా, అదే ఆహారాన్ని అదే ఎక్సర్సైజ్ని కొద్ది రోజులు మీరు అలా పాటించగలరా లేదా, అలా పాటించేటువంటిది అయితేనే చేయండి. అది పాటించలేని పద్ధతి అయితే దాని నుంచి మీరు దూరంగా జరిగి ఏది మీరు సస్టైన్ చేయగలరో దాన్నే ప్రాక్టీస్ చేయమని చెప్పారు. దట్స్ ఫర్ మై ఆడియన్స్ ఇన్ తెలుగు, డాక్టర్. जी
Thank you,
आप
thank you.
anyway you are concluding it in Hindi as well, so I would not ask you. In case you want to add something in Bengali, please go ahead, doctor.
Again, নমস্কার যারা বাংলাতে শুনছেন। সো ডায়াবেটিস রেমিশন ইজ পসিবল, ডায়াবেটিস রেমিশন হওয়া সম্ভব, কিন্তু তার জন্যে ইউ নিড টু ডু অল দ্য রাইট থিংস অ্যান্ড যা যা কিছু আপনি করছেন ডু আন্ডার মেডিকেল সুপারভিশন। সো ডোন্ট স্টপ ইউর মেডিসিনস অন ইউর ওন, ডোন্ট ডায়েট অন ইউর ওন। সো ইউ নিড এ স্ট্রাকচার্ড প্ল্যান টু ডু ইট। সো দ্যাট হ্যাজ টু বি ডান ইন দ্য রাইট ওয়ে অ্যান্ড যেটা আপনি করছেন সেটাকে ইউ নিড টু, দ্যাট শুড বি সাস্টেনেবল। সো ডোন্ট গো ফর সামথিং উইচ ইজ ভেরি ভেরি এক্সট্রিম, যেটা কয়েকদিন পরে আপনি করতে পারলেন না, অ্যান্ড হোয়াট এভার গেন ইউ হ্যাড with so much of difficulty you had achieved that, you will again come back to square one. So it's remission can be done, but you need to do it under medical supervision. You need to, and even after that you need to continue your lifestyle changes. It's only a remission, not a cure. It's not reversed. It has, it's only transiently the medication requirement kome gache, but for it might, you might require, whenever you become relaxed it might come back.
Yes. So now, one question. One more thing, doctor. I would want to take. There's so many questions here in the chat box. I'm unable to filter them. But I've directed my. Today, I want to take up questions which are related to remission. So I'm
Right.
avoiding a lot of general questions and giving you only questions related to remission. So here's a question about gestational diabetes remission. Ranjana is asking that if one is diagnosed as a gestational diabetic person, can that be called as curable or reversible, or is that remission?
That is a very important question. So we have almost risk of 2 to 3 actually have gestational diabetes out of 10. So the numbers have really gone up. The reason is because obesity and lifestyle changes and other reasons for which diabetes and obesity are becoming more common. So gestational diabetes is diagnosed at 24 to 28 weeks of pregnancy. Usually it's related to hormonal changes that occur during pregnancy, and after, sometimes it's controlled on diet, sometimes we require insulin to control it, and once delivery, after delivery, it the medication requirement goes down, the insulin requirement goes down, and the person can usually go back to a normal diet pattern. So this is the, so gestational diabetes is a self-limited disease that occurs only during pregnancy. But there is a big but to it. So if this is something which is like a treadmill test for us. सो इफ
जी
समबडी, अगर आज मेरे को कार्डियक प्रॉब्लम नहीं है, लेकिन मेरे को दो कार्डियक प्रॉब्लम होने का रिस्क है कि नहीं, वो पता चल रहा है मैं अगर ट्रेडमिल टेस्ट से मेरे को पता चल रहा है, राइट? Similarly, if you are having gestational diabetes, you are at a very high risk of diabetes in next 5 to 10 years. So
जी
take gestational diabetes as a very important message that your body is predisposed to diabetes. So if you need monitoring after delivery, after 6 weeks, it should be monitored again, the sugars, to confirm that the sugars have gone down, and that person should take it as a warning sign. So most mothers who deliver are very happy and सबको लड्डू खिलाया जाता है, and they so they go they because so that is the Indian tradition, at least the North Indian tradition. About those things you have to be actually very careful. So gestational diabetes, take it as a warning sign. At least if you don't have to go into a full-fledged diabetic diet, but start doing the right thing. So avoid excess calories, avoid excess of junk food, avoid maybe direct sugars, you start avoiding. So some sort of restriction will have a very long important role in preventing diabetes in future. So gestational diabetes immediately is going to be cured. Long term you need to be careful. So
wonderful
it's like a
doctor
stress
thank
test for diabetes. It's like the TMT for diabetes. So even for
great
steroid, I want to reinforce, if somebody has a steroid-induced diabetes, that is also like a stress condition which has precipitated diabetes. So again, it's like the TMT for diabetes. If steroid-induced diabetes and gestational diabetes will get cured, but the chance of diabetes in the next 5 10 years is very high.
Correct. So keep a monitor on, keep all the tests that doctor had advised a little while ago, and make sure that you have great lifestyle practices in place. So let me come
Absolutely.
back to this question about drug usage and side effects that a lot of people are asking. क्योंकि डायबिटीज एक लंबे समय तक ड्रग्स लेने वाली कंडीशन है. So people are asking, will metformin on a long term cause side effects? Karthik, Geeta, a lot of them are asking. So one quick thing about diabetes drugs and effects of it on
See,
other parts.
most of the diabetes, you there are, for anything you need to raise the balance the risks and benefit. So if you are doing any intervention, आपने गोलगप्पे खा लिया, तो that gives some satisfaction to your taste bud, but you also carry that risk of infection you get from it. So but you feel nahi, my taste buds are more important, so I will have golgappa. So मेरा infection का chance उतना है नहीं, मेरा immunity बहुत strong है. For the same way, most medicines which are used for diabetes, the benefits are much more stronger than the risks. The risks we know, they are predictable risk. If somebody is on metformin, if somebody might have some stomach problems, gastric problems. So these are some GI side effects, are known side effects of metformin. Some side effect related to vitamin B12 deficiency. Those are all very correctable, predictable side effects. And so we know the side effect profile for most of these drugs. None of these drugs have a long-term impact on kidney, liver, heart, or anything. So these are all protective medications. Most of the impact is because of diabetes and related metabolic complications. So metformin, very common myth, metformin लेने से मेरा kidney खराब हो जाएगा. So that is total nonsense. I am using this word, so that has got no scientific basis. So metformin does not damage your kidney. It's the high blood glucose that damages your kidney. Metformin even can be safely given to a till creatinine values. We have the GFR to assess the kidney function. GFR values above 30, so it does not damage kidney in any way. None of the other drugs damage kidney, liver, or heart. We know the predictable side effects. We need to monitor them from time to time, but nothing on the long term. All long term damages are because of sugar and associated metabolic complications only. So medicines, most allopathic medicines are safe. They do not have any long term side effects.
Great. So, Geeta and Karthik, I hope the answer is giving you some kind of hope. So, I have a question from Shruti, who's 25-year-old female, diagnosed with pre-diabetes. I have PCOD and diabetes family history, and now overweight due to PCOD. Will I surely get to diabetes stage in near future? Can I get into remission? And also, while we're talking about pre-diabetes, Rajesh Kakre is also asking about, can I get back? एंड किसी और का आई मिस द नंबर, थायराइड भी है उनको, एंड आई डिड मिस द नेम, बट ग्रेड 1 फैटी लिवर, BMI is high, taking thyroxine 50, will my diabetes be reversed? Other hormonal complications and thyroid or other things with diabetes, what is your take on this?
So obviously PCOD has a girls with PCOD or ladies with PCOD, they do have a tendency for developing diabetes. So,
Acha.
but again, she said that she is overweight. She needs to work on that. If she is able to lose weight, she might actually prevent it. So it's nothing. Pre-diabetes is something which is so it's a far less advanced stage than diabetes. In diabetes already, so I told you 70-80% of insulin secretion is believed to be lost when somebody gets diagnosed with diabetes. So pre-diabetes is a much earlier stage. So if you intervene at an earlier stage, the chance of reversal is much higher. So if you start leading a healthy lifestyle right from the beginning, even without pre-diabetes, so the chance of developing pre-diabetes and diabetes is going to be less. So it's not that you don't have pre-diabetes and you start eating everything. So after a certain age, some form of uh, restriction in terms of diet, about how much calorie the person is taking, in what way he is taking that calorie, that should help a long way in preventing the pre-diabetes and diabetes both. So pre-diabetes is be reversed. It's easier to reverse pre-diabetes. Diabetes can be can go into remission, not reversed. And but again, you really have to work hard to do that, and you need to keep on working harder to maintain that. So these are two important things. For thyroid and diabetes, there are some direct and indirect connections, not a very close association, though people tend to associate a lot of things with thyroid, including weight gain. But again, weight gain related to thyroid is only 3-4 kgs maximum. So most of the weight gain is uh, because of the lifestyle, and people attribute it to thyroid. So from my so my
Yeah,
take
छुपा
is
रही
that,
हूँ.
that if your TSH is normal, if you're taking the right dose of thyroxine, so you just need to keep on taking the right dose to maintain your TSH in the normal level. And most issues related to thyroid are settled because your TSH is normal. The hormone is deficient, you are taking it from outside, you have TSH as a monitor for that. TSH is normal. For 98%, most of the issues will be settled with that.
I should be seeing you very soon, doctor, in your clinic, because I've been blaming my thyroid for my weight gain for so long, and I did not act on it till the time that the alarm bell rang in my head, and I said, "Oh no, I need to do something about it." And of course, I'm back on track. But yes, this is a
Thank
great
you. That's great.
motivation.
That's great. Yeah.
Yeah. So quickly, doctor, one question which is important about the hereditary and the family history that we need to take into consideration. Here's a question from Nirmala, who's asking, I am diabetic, she's diabetic, but can she plan for a baby and be rest assured that the kid will be diabetes free? Then here's a registered user's question. Sid is 41. Both my parents have diabetes. Can I totally avoid diabetes in my lifetime? So these are two. One unborn child के बारे में parent का है, and then the child of both parents' family history.
So again, these are two very important questions. I will take Sid's question first. So, so what is the prevalence of diabetes in say in India in an urban center? So it's like 1 in 10 adults. So if one parent is diabetic, the risk becomes 2 in 10. So it was earlier the risk for having diabetes was 10%. So if one parent is diabetic, that almost doubles and becomes 20%. So
How
if
about one
both the parents are,
grandparent?
so
Grandparents
some
भी लेना.
so even the risk will definitely remain higher. So if both the parents are diabetic, the risk will become almost 40 to 50%. So there is a 50% chance there is a tendency to there will be a tendency to develop diabetes. Another 50% chance the person might not develop diabetes. So to prevent that, so you start leading a healthy lifestyle when you don't have diabetes. So if
Correct.
you are not having diabetes, and if you are at high risk of diabetes, so anybody who has a strong family history of diabetes, anybody who is overweight, anybody who is obese, anybody who is having PCOD, anybody who is having gestational diabetes. So these are all situations which predispose you to diabetes. So if you
Hmm.
are taking the right steps right from day one, the chance of developing diabetes will drastically go down. So you need to the risk. Need to go understand the discuss it with your doctor that these are my risk parameters. So how I should be leading my lifestyle, how frequently I should monitor, how I should be eating my food. So these are important things which you start doing right now. तो डोंट वेट अच्छा मेरा प्री डायबिटीज हुआ तब मैं थोड़ा सा मीठा खाना बंद कर दिया, फिर मैं डायबिटीज हुआ तो मैंने ठीक है चीनी तो खाना बंद कर दिया, चलो गुड़ खा लेता हूँ, तो वो दैट दैट कैन नॉट बी डन. सो सो दैट दोज थिंग्स आर very important. So you need to understand your risk and start working right from day one.
Yeah.
And I'll
So,
come to the second question. So for related to pregnancy, so it's not that the baby is going to have diabetes right in the beginning. So if the mother is having diabetes, it's very important to have a good glycemic control right from before conceiving. In fact, so when somebody is conceiving, so somebody gets to know at 5 to 6 weeks, and that is the most important time for organ development, 6 to 12 weeks. So we don't want too many experiments and new treatment at that time. So usually the diabetes control should be optimal before conceiving itself. And if you are able to control your glucose uh, throughout the pregnancy in a normal way, so if the baby's weight is normal, the baby is not neither overweight nor underweight, the chance of uh, pregnancy related diabetes coming because you were pregnant during you were diabetic during pregnancy, that's not going to be there. Obviously what I told is that if one mother is if one parent is diabetic, then the chance is like 20%. So the risk will be slightly high because of genetic reasons, but those risks will manifest at the age of 30, 40, 50 years. So it's not right now after birth. So so if the glycemic control throughout delivery, usually it's done with insulin, has been optimal, so nothing to worry that the kid is going to have any problem right now.
great doctor, great assurance that you have given that diabetes में reversible और cure possible नहीं हो सकता है, but remission हो सकता है कि लंबे समय तक बिना medicines के या बिना other risk factors के रह सकते हैं. Then that is in our hands along with your guidance. Great advice. Thank you, Dr. Saptarshi. So I'd
Thank you.
want you to give me कि रेमिशन को लंबे समय तक रखने के लिए कि डायबिटीज रिवर्सिबल नहीं कर सकते बट रेमिशन लंबा होने के लिए क्या मैनेज कर सकते हैं, कैसे टिप्स दे सकते हैं?
So again, the most important thing is you if you have remission with diabetes, first of all, I should congratulate you for that, because it's very difficult to do it. So only it's not that everybody with diabetes is going into remission. Only a very select few who are very motivated can actually do it. So if you have gone into remission, you need to restrict your calories, limit it according to your body weight. So it should be on the lower side calorie intake. So you should be avoiding simple sugars. You should be avoiding saturated fat and trans fat. You should be avoiding excess of processed food. So all these are very important. If there should be a physical exercise regimen for at least 40 minutes, or even if you actually have to maintain your remission, maybe you need to do more. and and on top of that, maybe some form of distressing is also important. We know that mental stress also has a major role to play. So these are all very important things which you need to keep on doing to maintain your remission, and hopefully diabetes is not going to come back again. And for people like you, we can tell that diabetes has been cured, but for most, we are not able to tell that. We can only tell that that person has gone into remission and there is a risk of diabetes coming back. Thank you.
Great, Dr. Saptarshi. It was wonderful Sunday morning with you and a very eye opening session with what patients and with the wonderful information that you've given. I think let's change the way we talk about diabetes. Let's not look out for reasons to get it cured or reversed. Let's not get into false hopes. Let's get into remission phase and let the remission phase last longer. Thank you, doctor. Thank you so much for
Right,
the
right.
positivity.
Thank you, thank you, thank you.
Yes, so that is Dr. Saptarshi Bhattacharya with powerful information. And now, with the same power, go ahead and answer my questions. I'm going to come up with health quiz. 3 questions I'm going to ask you now. Answer the questions only on YouTube chat box, and winner's name will be announced towards the end of the show. And winners, of course, will be selected at the sole discretion of Apollo 24/7 team. If I declare your name to be the winner for this week, please write back with all your contact details to marketing@apollo247.com. Gift vouchers will be shared with you. चलिए आज के 3 questions आपके स्क्रीन पर आएंगे और ये रहे आपके questions. Question number 1, true or false में जवाब दीजिए. The first question is HbA1c is a 3-month blood glucose average. Is that true or false? Question number 2, fill in the blank please. KBC dash that the blank by Bethe Jeeto jackpot win 1 lakh rupees. Oh wow. Was it? Did I read the question well? Okay, what is the entire fill in the blank? KBC के अंदर आप 1 लाख जीत सकते हैं. डैश बैठे जीतो जैकपॉट. दिस इज सच अ डिफिकल्ट क्वेश्चन. मेरे मुंह से आंसर निकल ही जा रहा है यार. प्लीज. So the question number 3, name the instrument used for measuring glucose levels in the blood. Name the instrument used for measuring glucose levels in the blood. These are the 3 questions on your screen. Go ahead, type your answers and let's see who is typing the answers. True, yes, glucometer, घाट घाट नहीं, कुछ और है. रम्या, spelling mistake. Go ahead, type your spelling correctly. All right, and while you guys are answering your questions, let me go ahead and give you the health coupons, the discount coupons that you can use on Apollo 24/7. Coupon first one is code FIRSTVC. You get flat 150 rupees off on first online doctor consultation. Doctor consultations direct from Apollo. अगर आपको डॉक्टर सप्तर्षि भट्टाचार्य जी से कंसल्ट करना है, download Apollo 24/7 right now and use this coupon. You get आपके online consultation पे आप 150 rupees off पा सकते हो. The next coupon that we are giving is first 3. Use this to get 25% discount from Apollo 24/7 से जब भी आप medicines order करते हो, you get 25% off on the online medicine orders. And exclusively for Health Hour viewers, this Sunday we are giving away a coupon which is HH247. You get 199 rupees off on an online consultation with Apollo doctors and almost 20% off on medicine orders as well. This is an exclusive coupon. You can use this in addition with the other coupons that we shared with you today. Great. And then let me see. Wow. इतने सारे लोग आज questions के answer type कर रहे हैं. Either the questions are easy or you are trying to participate more. Whichever is it, I'm very happy about it. And here are the winners. Congratulations, Sandeep Kaur, Abhishek Agarwal and Ramya Nagaraj. Congratulations. I repeat the winners. Sandeep Kaur, Abhishek Agarwal and Ramya Nagaraj. Write back to us and claim your gift vouchers. Next week, बहुत ही important topic है. How to prevent heart attacks. अगर heart attack के बारे में आपके जो भी questions है पूछने हैं तो join हो जाइए next Sunday, that is 25th of September 11 AM. World Heart Day celebrate करने वाले हैं हम, and also we'll take your questions in the live session. So see you there. If you don't want to miss this session, Apollo 24/7 YouTube channel को subscribe कीजिए and bell icon भी दबा लीजिए so that you get notification alerts as well. Thank you so much for joining on this live session today and asking all your questions. We shall see you next week. Thank you.